I can't tell you about the last time that I got high. I can't tell you about the 87th time that I got high. But I can tell you about that very first time. The first time that I did opiates, it was a feeling that I had found what I had been looking for.
When I took the opioids for the first time, I felt like I could take on the world. I didn't care about anything or anyone.
He told me at some point that they made him feel like Superman. What 16-year-old kid doesn't want to feel like Superman? And I honestly think he had no intention of ever dying from this disease.
One of the things that we're always told is, well, once they hit rock bottom, they're going to wake up. But you don't know that rock bottom is way down there.
There was a month where every morning I was waking up in a different hospital from an overdose.
I didn't use heroin until after I got out of jail, and I overdosed the first time I used it.
That drug is so strong and so powerful, it just calls you.
I'm here because I have no other option. I've literally lost everything that I have worked hard for.
Opioids are wiping out our generation.
These kids are battling every single day.
Someone has to do something. Someone has to talk about it. It's an epidemic.
And thank you for joining us for today's event to discuss Gateway, a new documentary from our partners at Choices Matter. My name is Renee Barros, and I'm one of the community engagement directors here at Shatterproof. Here with me today is Shatterproof Ambassador Jen Wysong. Jen became addicted to opioids after receiving a prescription to manage pain after a C-section. Although her path to recovery was riddled with setbacks, she has been in recovery since May of 2016. Jen is now a peer support counselor at Recovery in Motion in Chestertown, Maryland. She's now working at the same treatment facility that supported her journey to sobriety. Welcome, Jen.
Hi, Renee. Thanks for having me.
Also joining me today is Dr. Richard Chudacoff, an OB/GYN at the forefront of addressing the opioid epidemic by providing his patients with an opioid-free surgical experience. Fueled by a personal connection to the opioid epidemic, Dr. Chudacoff is an advocate for utilizing non-opioid options to manage pain after surgery. Welcome, Dr. Chudacoff.
Hi, Renee. Thanks for inviting me.
Now, before we get started, I just wanted to mention that Choices Matter is a national movement designed to educate and empower patients to have proactive discussions with their clinicians about available non-opioid options for managing pain after surgery. We hope you've taken time to watch this powerful film. However, if you haven't, Gateway follows 3 families inadvertently impacted by opioid addiction that began with a prescription to manage pain after surgery. It provides an intimate look into the struggles that can be caused by legal opioid prescriptions when the dangers of these medications are not properly understood. We're excited to have Jen and Dr. Chudacoff with us today to discuss their involvement in Gateway and to answer questions from the Shatterproof community. We encourage your input. Please feel free to ask questions in the comment box below at any time for our guests. Now, right off the bat, Dr. Chudacoff, we have to ask, how is Becca doing?
Becca is actually doing better. We had a really tough few months where she was in and out of detox numerous times. But she left detox Friday, and I must admit she's a changed person. Fingers are crossed. We're really hoping that she continues to stay sober and try to stay sober, but the last 3 or 4 days have been actually wonderful.
Great. Happy to hear she's doing better. We're all sending our thoughts and prayers and rooting for her.
Thank you.
You're welcome. Jen, let's tell us about the movie. Let's hear about what it was like to let people into your life on such a personal matter.
The movie has been such a blessing to be a part of. It was put together by Dana, who directed, produced, and wrote it. She did such an amazing job. I I feel so grateful to even be a part of it. I did not expect it to be as big as this has turned out to be, and it's been an amazing journey. I was a little bit apprehensive at first to put my personal story out for the world to see, for fear of judgment or lack of understanding. But as it progressed and we went along, I got to understand that it's just like what I do in my everyday life. If I tell my story and my experience, strength, and hope, then it can possibly help somebody. So I'm really glad that I got to be a part of this, and can't wait to see where it goes from here.
I'm sure you've achieved that objective of helping someone. So it was really eye-opening to watch your story and knowing that you took opioids that were prescribed by a doctor and you were assuming they were safe, right? Given your experience, what advice would you give to a friend or a family member who was going to have a surgery?
The advice that I would give to friends and family members would be to educate yourself, advocate for your health, your body, empower yourself. Don't be afraid to ask doctors questions, figure out what your options are for surgery, and don't be afraid to get a second opinion. Don't be afraid to say no. This is your life. This is your body and your health. And we have to learn to be advocates for ourselves, because if we're not, then no one else is going to. For my experience, I wasn't knowledgeable on the fact that there was more than one option. We take, the suggestions from doctors and go with it, which is fine because they're doing their job. But if you have, questions or fears, then we need to speak up for ourselves just to protect our health.
I would say that's sound advice. Dr. Chudacoff, how did your daughter's experience impact your views and approaches as a surgeon?
Well, obviously, it changed my idea of people who were substance abusers. Growing up, there was a stigma attached to people who were using drugs. It was those people. But, my youngest daughter grew up in a very, upper middle class family. She has 3 older sisters that all went to school, very successful in their post-grad lives. So it taught me that we don't actually know the true story about how people got addicted. And then obviously understanding her initial introduction to narcotics and realizing what I did in my practice, there was a relationship. Luckily, I've always sort of had a protocol of not using a lot of narcotics, but when the whole idea of what we call ERAS, or enhanced recovery after surgery, came down the sort of into mainstream, it made sense to be either opioid free or significantly opioid reduced.
Okay, we have a question from one of our viewers on Facebook, and it's a question for both of you. How do you feel about medicated assisted treatment?
You want me to go first?
Sure.
What do you say that again? What does that mean?
So for maintenance, medication assisted treatment, I feel personally that if you're striving towards recovery in whatever way that is, then you're on the right path. Everybody's road to recovery is completely different. For me, I had tried maintenance before. I had tried Suboxone and it wasn't right for me. I needed to be completely abstinent from all mind-altering substances, or I was not going to stop using. For other people, they take Suboxone or methadone or whatever other MATs that they need, and it works for them. I feel like if you're bettering your life and you're able to progress in your recovery, then to each their own. I know a lot of different programs and fellowships have certain opinions of the maintenance, and won't let you celebrate or get chips or key tags. But I feel like if you're going from doing the extreme as opiates or heroin or stealing to get your next dose, and now your life is completely done a 360 and you're on maintenance, then good for you, you're on the right path.
I apologize, I didn't actually hear the full question because there was some noise in the background. And I'll tell it, I agree with Jen completely. There is no one size fits all when it comes to sobriety. And everybody actually has to find that which fits them. I would think obviously to be free and clear of everything would be optimum, but that would be my opinion. Other people feel that they have the use of Suboxone, Vivitrol, methadone. If that works, then it works.
Great. Another question from one of our viewers. This one's for you, Dr. Chudacoff. Someone was wondering if you educate other physicians.
Do I educate other physicians? I try and I try and I. One of the difficulties I find with physicians is, well, it's a joke that a good friend of mine and I have, is that the problem with doctors is they're always the smartest person in the room, even when the room is full of other doctors. Obviously, that can't be true, can it? But they tend to hold on to their beliefs. The other problem with physicians is they tend to get in a comfort zone and not actually like to do things that they weren't trained to do. However, there is, as I said, this whole enhanced recovery after surgery movement in medicine to reduce or go opioid free. For example, 5 years ago, 6 years ago, when I started this opioid free quest of mine, it was very difficult to find doctors who agreed with me. Now, when I talk with physicians either on LinkedIn or in hospitals, I would say almost 25% of physicians are saying, oh yeah, we're opioid free or we're opioid reduced. So it's a quest that I have. It's my crusade to lessen the number of opioids used, opioids written for, opioids used during the surgical procedure itself. And I think that we are turning a corner in our healthcare system.
Well, I'm sure I speak for many when I say I applaud you for your efforts, because that's quite the undertaking to shift the way that a lot of doctors think about opioid prescriptions. Our next question is for you both, and the question is, what do you all know about Vivitrol?
Do you want me to go first?
Sure.
Vivitrol, well, at the facility that I work at, the Whitsitt Center, it's all my knowledge is where I work. And I know that it's a very popular shot that people, our consumers, have tended to get. You get the shot once a month in your butt cheek, and it's not very pleasant. But I know for 30 days, they have reduced cravings, sometimes no cravings at all, which is one of the hardest things to fight when you're trying to get clean, is that thought, that obsessive thought process. And I think it also has a blocker in it. I'm not 100% sure. I never used it myself, but I know there are a lot of people that have taken it and had success stories on it. I know that a lot of consumers, throughout the years that I've worked there, have gotten it and then tried to use on it. And it can make you really sick if you do that. So the key here is don't use on it. That's the whole plan, is to get the shot and not have to worry about taking a pill or a strip of Suboxone or going to the clinic every day. It's set it and forget it, basically. You got 30 days and you're good.
So Vivitrol is what's called an opioid agonist antagonist. So it has some pro-opioid actions and it has some anti-opioid actions. So it is used in conjunction with other options as far as to enhance the chance of detoxification as well as maintain sobriety. Unlike, say, Narcan or naloxone, which is a pure antagonist, meaning it blocks the opioid receptors, Vivitrol works to sort of, I guess, ease the transition without actually giving the high. But Jen's right, it can cause people to feel pretty bad if they are using it. But unfortunately, some substance abusers will try to, work right through it. One of the things that Jen said about this 30-day recovery period, we need to understand that it takes about 2 years for that opioid molecule to get out of the system. So our current policy, or the current thought of, detox, and then 30 days of recovery, and then outpatient, treatment. I wish we had money for 2 years.
Dr. Chudacoff, do you believe that addiction is a disease of the brain?
Oh, absolutely. Addiction is sort of this dichotomy. There's two senses to it. First of all, we do know that when somebody uses heroin, there's a physiologic change in the brain. Literally, the brain changes its shape. It changes its neural function. So physically, that alteration is a disease. The problem is that we also look at addiction psychologically, or maybe as a weakness. And so where somebody had cancer and they were being treated and they had a relapse, you wouldn't get mad at them. You wouldn't say, "Oh, you relapsed, you idiot." On the other hand, somebody's going along, they're 8 months sober, and the next thing you know, they're using again. It's kind of hard not to look at them as psychologically weak. But it's the same as a cancer relapse. It's a disease. And so it's hard for the public, it's hard for me as a father, it's hard for physicians who are even less empathetic than I to not bring in the psychological aspect and not appreciate the physical aspect. This is what makes treatment of substance abuse so difficult for not only the patient, but the healthcare worker as well.
Absolutely. Jen, what are your thoughts on prevention education in schools? Are there certain ideologies or skills that you could have learned that would help a teen while you were a teen that would have been helpful for you as an adult?
Well, that's kind of difficult because, I learned a lot about drugs being bad and not to use drugs, growing up in school. But when I was in school, things were so different. I think that my next goal is to enter not only Gateway documentary, but my experience into schools. That's one thing that I'm aiming towards, because now I'll say for myself, the reason that I justified taking the Percocets and all that was because it was man-made. And I think it was drilled into our brains as children that heroin was bad and all that. We justified it. I think that it's so much more common now than it was when I was in school, that it's looked at differently. I think prevention is definitely important, especially because it's so common. It's in everyone's homes, you know, for surgeries. Like, that's the reason that we're talking about this to begin with. And I think conversation is 100% key to preventing, you know, our next generation from becoming the next, you know, epidemic that we're having right now. I don't know. I guess because stigma was so attached to it. And like Dr. Chudacoff said, you know, it's hard for people to understand. There's a stigma attached to whether it's a disease, whether it's a choice. And at this point, it's like, I don't really think that that's what matters. It's just, what do we got to do to stop it? So I guess detaching the stigma from addiction and being more open to talking about it, because it is a real life problem. I know a lot of schools don't want us in there to talk about what's really happening. And that's why I'm grateful for this documentary and the platform that you guys have us on, because it is reality and we need to talk about it.
Absolutely. Dr. Chudacoff, as a dad, what advice do you have for other parents who have a child with substance use disorder?
Have a lot of patience. It's as a father of a daughter or child who has a substance abuse disorder, it's incredibly trying. You can't wish it away. I think that when I started working with Gateway and I actually put it out that my daughter had a substance abuse problem, it opened things up for me and for my wife. My wife was very stigmatized and she didn't want anybody to know what was going on. But once it was out there, not only did she realize how empathetic her friends were, but how common it was as well. And how many people came forward and said, either, yes, I have a daughter or a brother or a parent who is addicted, or I lost someone. And as hard as it is to say, because you do feel embarrassed by the fact that your child isn't perfect, the knowledge that it is so prevalent makes it a lot easier to deal with and to find resources.
Definitely. Jen, do you have any suggestions for developing a surrogate family while in recovery?
What do you mean? I'm sorry.
I think what they mean is maybe if you have a family that's not supportive, or the people that you've surrounded yourself with up until you were in recovery may not have been so great for you.
Well, for example, when you go to, I go to 12-step fellowships, you gain a type of family through them. Your network, your sponsorship family, there's people out there that are willing to support you. Not everyone's going to be understanding. Not everyone's going to accept your amends. And in active addiction, we hurt a lot of feelings, and we cut a lot of ties, burn a lot of bridges. So in my experience, I'm very fortunate to still have my friends and family there to support me, but not everybody has that. And there are people in these programs that have gone through the exact same thing that you've gone through, or worse, or know somebody who they can point you in the direction to for that support. We also have, what I do is peer support. If you have no one else or you don't know where to turn to, you can go to your local health department or treatment facility and, seek out a peer support. It's someone that you can talk to, that you can ask questions to and get resources from. There are people out there that are willing to help, regardless if you have your immediate family available to you. And by the grace of God, and hopefully, with getting clean, maybe those amends can be made and you can have your actual family afterwards.
Great answer. Dr. Chudacoff, are there non-opioid options available to treat post-surgical pain?
Absolutely. The process that I was talking about is enhanced recovery after surgery, or ERAS, actually uses sort of a novel idea. Think about it. You're going to have surgery, you're going to have pain. So why not start treating the pain before the surgery? So for instance, in the cesarean section, prior to the cesarean section, we will actually give Tylenol, oral Tylenol or IV Tylenol. At the time of surgery, as we're closing up the layers, something's injected called liposomal bupivacaine, which is an anesthetic that lasts for 72 to 96 hours, as well as regular bupivacaine, which works immediately. So now you have the numb for 4 to 5 days. Right at the end of the case, we use something called ketorolac, which is a, say, IV-like ibuprofen. Well, 3 hours later, patients are started on oral Tylenol. 3 hours later, after that, Motrin. And then every 3 hours, they're rotating the Tylenol and Motrin. What this does is actually allows us to keep pain medication in the patient continuously so that they never get to the point where the pain is overwhelming. Or should I say there's a difference between pain and discomfort. We're trying to, you're never going to be pain-free. So what we're trying to do is keep the level in the discomfort zone and not into the pain zone. Now, the problem with opioids and narcotics, same thing, is that they don't treat pain, they treat the brain. They make you not care that you're in pain. But as the narcotic starts to dissipate, it actually hyperstimulates the nerve endings. And so you need to increase the dose to get to the same level. And this is where the addiction comes, that you always have to go higher and higher and higher to get to the same level that you were before. So when we're actually treating the pain prior to, during, and immediately after surgery, as well as increased mobilization, getting patients out of bed as quickly as they can, returning to activities of daily living, we're finding that we don't even have to use the narcotics. I mean, and, you know, as an aside, it's interesting. I never intended to actually become opioid free. It's just when this medication, this liposomal bupivacaine, came on the market, and using all the other techniques that I mentioned, my nurses started telling me that the patients were no longer asking for opioids. And that's when the light bulb went off. And I said, look, everybody, every OB needs to know how to do this, because we can offer this service, which is such a great benefit.
One of our viewers had a follow-up question to something you said earlier, which was, you said it takes 2 years for the brain to recover after the last use. Is that the same for MAT meds as well, because they're opioids?
I don't know. I can only tell you what the morphine molecule will do based on my research.
I know a little bit about it. It's called PAWS, which is post-acute withdrawal syndrome, which is what Dr. Chudacoff was talking about. And I believe that MAT, you still need detox from it. Suboxone, at first, and I'm not 100%, I'm not a doctor, but I know at first it was just primarily for detox. And now it has turned into a maintenance medication. The longer you're on it, the harder it is for your body to get off of it, just like an opiate. So what it means in layman's terms is that your body is going to take up to 2 years to get back to normal, to readjust to its normal everyday self. Your brain has to readapt, your, everything has to go back to normal. So if you've been taking maintenance drugs for years and years, just like you would with a substance, it's going to take up to 2 years for you to get back on track with everything. It may not be as long, as heroin or Percocet or something else, but you will have an adjustment period, and it's different for everyone. So
that makes sense. Dr. Chudacoff, do you believe all doctors and nurses should be required to learn about and be trained in addiction in medical school, like the federal law that is trying to get passed?
I can't talk about other health care providers. I'll tell you that in medical school, we do learn about it. And I have a daughter who's in medical school right now, so I'm aware of what they're doing, even more contemporarily than when I went to medical school. We are trained. Whether that continues into our residency program and post-training life, that's the question, that's the conversation that we're having. Mandating things, making it a law, now we're getting to a little political discussion that I'd rather not. I think that physicians themselves, for the most part, are honorable and moral people, and we wouldn't go into healthcare if we didn't actually care about patients. I think that through taking CME courses, which are required to maintain your license, and I know one of them just recently was about the opioid crisis and opioid addiction, would probably satisfy that, but more laws on the books? I'm sorry, I'm not going there.
I can see that. Jen, if you needed surgery in the future, how would you approach pain management?
That's a terrifying thought. It's been one of my biggest fears since I've gotten clean. And I think one of the reasons I'm so grateful for Dr. Chudacoff and the knowledge that he's had about this, because, you know, I did have a daughter early, and I did have a C-section, which was with prescription pain management. I felt like if I ever wanted to have another kid or have surgery or get my wisdom teeth removed, you know, I wasn't able to do that. So I feel like I would be confident enough to go in, talk to my doctor, and be like, look, I really don't want any narcotics. What are the options here? I want every available option on the table. And if I don't feel comfortable, then I'm just going to have to walk away, get a second opinion, or do better research on, you know, what is available out there for whatever I would need to have done at the time. I know that in reality, there may be a time that I come across, God forbid, an accident or something that, you know, it's just one day at a time. I just hope that that never happens. And I think that I'm educated enough now to know that there are other options out there for me other than narcotics.
And that's one of the points of the film, right? Is to empower the viewer to ask these questions ahead of time when they're seeking medical advice or prepping for a surgery or things like that. Another question for you, Jen, from one of our viewers on Facebook says, my daughter is looking for a program that does not follow 12 steps. Do you know of any other non-12 step programs that are as effective?
There's a lot of things that are available. It depends on the reason she doesn't want to do the 12 steps, because if it's maintenance, then there's groups for people on maintenance. There's church, if you are into that type of thing. It doesn't always have to be a 12-step fellowship. You could do IOP, which is an intensive outpatient program, which is educating you on addiction and in a room filled with other, you know, substance use disorder consumers or mental health consumers. It just depends on what it is that you're looking for. It's really difficult because I've only done the 12-step fellowship, so I don't really know all the ins and outs, but I know that there are other things out there.
Thank you. Dr. Chudacoff, are non-opioid options available for other types of surgery, not just C-sections?
Oh, absolutely. So as a gynecologist, I use it in my gynecologic surgery. I know that they are doing opioid-free surgery, complete total knee replacements. They're doing it for chest surgery, mastectomies, other joints. There are ways of using everything that we have available to us to reduce or to go opioid free. One thing I wanted to interject something that the question that was asked by Jen, or to Jen, and to me. So it's not just the physicians that we really have to worry about. I was operating at a hospital not too long ago, and the patient was a recovering addict. And I said, well, lucky for you, I have this opioid-free protocol. She was very happy. Well, the next morning, went in to see the patient, and the nurse was about to actually give her opioids. And I said, what are you doing? There's no opioids written for her. She goes, well, we have to give her something. She's in pain. I said, well, if you give her the opioid, she's going to relapse. She probably has a 90% chance of relapsing if you just give her one. She goes, well, I'm only going to give her half of one. I go, you're obviously not getting what I'm talking about. She can't have any. And the same thing was actually going on with the anesthesiologist at some point, where they said, well, we're just going to give her some because you have to have opioids when you have surgery. I'm like, well, no, you don't. There are other options. They go, well, but when you take the uterus out to close it, I go, but I don't take the uterus out to close it. Okay, so now I realize that it's almost the anesthesiologist and the nurses are as addictive to giving the opioids as the patients are to taking. So that not by law, but by training, do we have to get the word out that we can be opioid free, and especially for our patients who are recovering. I was very happy to come across an opioid-free option specifically for my daughter, Becca, and for my other daughters, and for my wife, and for anybody else. So it's that education that we need to give the whole surgical environment that I think is important. It's not just the physician, because if they're out of the room or they turn the patient over to some other doctor, it might get lost.
Right, it's shifting the way everybody that's involved thinks. Is there any sort of advice or insight you could provide for someone who's looking to get involved in addiction medicine?
As a physician, there's a great and burgeoning field of addiction medicine. If you're already a physician, you can certainly get that as a subspecialty. As a non-physician, of course, I mean, look at the work that Jen does is certainly in that arena. As a nurse, there's certainly aspects of it as well. So there's a whole, world out there of anyone who is interested in partaking in that kind of training and that kind of treatment and education.
Thank you. Jen, with the current health crisis with COVID-19, how are you staying connected to peers and providing support to others who are in recovery?
We had to kind of take a step back and regroup, refocus on what we were going to do with the unknown of the COVID going on. We turned to technology. I reach out and I call my consumers at least weekly. We moved our support groups to virtual. So once a week, instead of meeting in person, we do it via the internet. We're doing socially distanced distribution of Narcan to anyone who needs it, and are available to do Narcan training over the phone or through video. And we're just trying to stay connected. Facebook is a great outlet, and email and telephone. I mean, that's basically what we have right now, and it's working. Just staying connected, I think, is what's most important. And I think you know, we've really showed a sign of strength in all of this. Like all of the 12-step meetings got closed, and I think that it hit the recovery community really hard, and we were all very scared. We're used to being around each other and giving each other hugs and, you know, supportive, and isolation is our biggest enemy, and we were forced to do it. So it was very terrifying. And within a week, I think there was meetings literally from one end of the earth to the other. Like I actually was in a meeting in Greece the other day, which was amazing. It's just been really inspiring to know that when put into a crisis situation like this, that we, you know, we will find a way to make it work and be there for one another.
Very nice. Any parting words of advice for our viewers from either of you? We can start with you, Dr. Chudacoff.
I do. You know, the opioid crisis basically started, you know, I would say a good part of it started with pharmaceuticals, and unintentionally, and that was the whole part of the Gateway documentary. We know that patients were going home with too many opioids. In fact, studies show that 80% of patients who go home with opioids don't take all of them. 80% of those patients don't lock up their opioids, and 80% of current heroin addicts started using heroin because of their addiction to pills. When you have a choice to discuss with your physician about your health care, and your health care, nobody else is responsible. Nobody is more important than you when it comes to your health care, and you have to take that lead. You talk to the physician, and if they're determined to give you these pills, you don't have to you don't have to go in and get the prescription. You don't have to take all of them. You can refuse them. Just stay empowered. Stay empowered. Talk to people, find the right physician for you, and remember that there's a world out there that's willing to help you.
Very great advice. We had another question come in for you. Do you think that safe site injecting centers help the epidemic?
I think that they allow prevention of secondary diseases, so that we're decreasing the risk for HIV and hepatitis and all the complications that can occur sharing needles or in a less than optimal site. I'm hoping that education occurs as well as allowing use of, you know, safety and cleanliness. Is that a word?
Sure. Why not? So Jen, any parting advice or words for our viewers?
Yeah, my final words would be, first off, thank you to Gateway and Choices Matter for allowing us this platform, putting us in this powerful position to change the conversation around addiction. We need to literally eliminate the stigma around it. It is around everyone that we know or someone we know, and it's got to end. The stigma's got to end. We have to talk about this. And I guess, like we talked about before, the prevention, harm reduction, the stigma, all of this is all intertwined. And, you know, being educated on options is first and foremost important. And then if you need help, reach out. It's so prevalent in today's world. We need to talk about it. We need to find resources. That's why I'm so grateful to do what I do as peer support. And they're all over. So any health department can guide you in the right direction. Don't be ashamed. Don't be afraid to reach out. Don't be afraid to ask questions. And just know that we're in this together, and it does get better one day at a time.
Oh, thank you for that. And thank you both so much for being here, for sharing your stories and answering questions. Gateway is an important film with a powerful message. You can watch the film and learn more about non-opioid options for managing pain after surgery at gatewayfilm.com. Thank you, Jen, and thank you, Dr. Chudacoff, for taking time to chat with us today.
Thank you so much.
Yeah, thank you. It was my pleasure.